Hi, Mrs. Smith. My name is Chanki Patel. I'm going to be your discharge nurse today. Congrats on the birthday of baby girl. We're going to talk about a few things before you discharge, just to let you know about some things. So first, we're going to focus on you. You want to make sure that you're eating foods that are high in fiber. That includes bran, broccoli, cauliflower, and fruits for a regular bowel movement. You want to make sure you're eating foods that are high in calcium, such as dark green leafy vegetables, milk, and yogurt. Drink plenty of water, and make sure you're not drinking sugared juices, just sugar-free juices. For hydration, you want to avoid soft drinks, teas, coffees, and alcoholic beverages. You want to make sure that you're increasing your daily activities, but you also want to make sure you're resting frequently. No lifting, pushing, pulling for at least 2 to 6 weeks until your physician gives you the okay. And also, you don't want to drive until your physician tells you it's okay. Since you're not planning on breastfeeding, there's some few things you need to know. You want to wear a well-fitted supportive bra all day. You want to make sure that you're wearing breast pads until your breasts don't leak. And if you're having any discomfort, just applying ice packs. You want to refrain from stimulating your nipples. You do not want to pump breast milk, or you do not want your baby to suck on it. You also want to apply a cold compress every 15 minutes at a time with like an ice pack or a wet towel. And you don't want to apply it directly on your skin, and do not massage or apply heat to the breasts. You want to focus on hygiene, so you want to wash your hands frequently. You do not want to wipe from front or back to front, so you always want to wipe front to back after you're going to the toilet, and use a Perry bottle with warm tap water every time you urinate or have a bowel movement. You also want to change your pad very frequently. So your vaginal flow will decrease. It should go from a bright red to a pinkish brown to a yellow and cream color, and your period may start anywhere from 6 weeks to 2 months after the birth of your baby. We want to avoid constipation. To do this, we want to increase fluids and fibers in our diets. We want to have a mild laxative or stool softener until your bowel movement returns back to the normal pattern. We want to also discuss birth control options with your healthcare provider, and we want to choose about a control method before having sexual intercourse. Nothing should go into the vagina for the first 6 weeks of discharge, so that sexual intercourse should be avoided until the bleeding has stopped and until that you feel comfortable physically and emotionally. Some signs to report to your healthcare provider is your pain, warmth, swelling, discharge, or foul-smelling discharge from your laceration since you had a vaginal delivery. You also want to report any discharge from the vagina that has a bad odor, severe headache, or blurred vision, temperature over 100 Fahrenheit, 100 degrees Fahrenheit. We want to report thoughts of harming yourself or your baby, any pain, burning, redness, warmth, or swelling in your legs, any pain, swollen, hot, itchy, tight, sore spots on your breasts, or any flu-like symptoms, any sharp pains in your abdomen, breast, chest, trouble breathing, dizziness, faintiness, crying spells, or mood swings that you cannot control, and you want to report being unable to empty your bladder, or having a bowel movement. You want to report any domestic violence abuse, so you want to call 1-800-96-ABUSE. Okay, moving on to your baby, you want to make sure that your baby is sleeping safely. So you want to put her on her back. Use sleep clothing such as a one-piece sleeper, not a blanket. You want to use a firm mattress, a safe mattress, and a fitted sheet. You should not put your baby in a car seat for nighttime sleep. Do not use pillows, blankets, bumpers, wedges, positioners. Do not keep soft objects, toys, loose bedding in your infant's sleep area. They can sleep with you, but they should not sleep in the same bed as you, and avoid covering the head of the baby, and make sure that they're not overheating. You want to use a bulb suction for their throat or nose if necessary. You want to keep it clean with warm soapy water after every use and allow it to air dry. You should always wash your hands or keep your hands clean before handling your baby, and you should always put the baby in a car seat if the car is in motion. You want to make sure that your home is safe, so question any unfilming your faces while they're talking, while visiting your baby, and you don't want to use any unsafe monitors. So some behaviors for your baby: it is totally normal for your baby to cry. Some reasons can be because they're hungry, because they need a diaper change, or they need to burp. You should always burp your baby after every feeding. Some calming techniques for your infant include changing their diapers, giving them a belly rub, or back rub, walking with your infant, rocking your infant skin to skin contact, or giving your baby a passy if that's what you choose to do. You should never shake your infant, and if you get frustrated or angry, put the baby in a safe place, take a break, and call a friend. Babies do require a lot of sleep, so they should you should wake their baby 3 to 4 times every or 3 to 4 hours for feeding, and you want to place your baby on their tummy for tummy time. This will help their neck and abdomen muscles strengthen. Okay, your baby should feed at least 8 to 10 times per day, and you want to hold your baby close to you while they're feeding, and they should be cuddled, and you should have skin to skin contact, and always put the baby on your shoulders to pat and rub for burping. If you do decide to formula feed, they should be receiving Similac or Enfamil. They will be sleeping for no longer then 4 to 5 hours, and if they miss a feeding, you need to wake your baby and feed them. They'll do about 2 to 3 ounces per feeding, and you need to hold them close to you. They should be cuddled, and you should not prop up the bottle, and they need to be burped after every feeding. A rash is normal. On your newborn, it should be small red circular areas with a white dot in the middle. This does not require treatments. You should avoid lotion, powders, and perfume soaps. Melias on the nose and especially on the face as well are pearly white bumps, and that will disappear within the first week. Jaundice is also normal. Your baby's skin will appear yellow, but this will start in the face and go down to the toes, but it will disappear. And if it lasts more than 24 hours, you need to call your healthcare provider. So bathing is very important for your baby. You should use a sponge bath first until the umbilical cord falls off. You need to use a soft washcloth and just plain water from head to toe, avoiding the diaper area until the last step. And you want to use like a mild infant type soap if you decide to. You want to keep the umbilical cord clean and dry, and you need to also notify the pediatrician if there's any drainage and discoloration, and you can clean it with warm soap and water. So the baby should go through 1 to 2 wet diapers in the first day or two, and then they should do 6 to 8 wet diapers and then every day, and they should have at least one bowel movement. First, it'll be like a yellowish green to mustard yellow, and it should soften. And you should record how many dirty diapers a day they have. And since your baby is a girl, we want to wipe from front to back and clean all the creases, folds to prevent a diaper rash. We want to pat dry, and there should be white and pink discharge, but that is completely normal. Want to make sure that your baby is dressed comfortably, and there's not too much clothing, not too many blankets, because they can become overheated. And the last thing is that your infant should receive all recommended vaccinations by a provider. So if that's all for today, I'm going to let you go. Please let me know if you have any questions, and also talk to your healthcare provider if you have any questions. Thank you.